Alrighty, I'm your host today. My name's Ruta and I'm part of the support customer success team here at Nookal. I've been here since 2019 and I do come from a corporate banking background where forms and processes were critical to the growth and success of our business. And I've also brought my customer service experience over to Nookal so that I can help you solve your issues, build your processes, and ultimately make sure you're happy and your business is booming. Just a few bits of housekeeping before we get started. We'll be recording this session and we'll be emailing everyone a copy when we're finished. Also, if you do have any questions, please feel free to enter them into the chat window and we'll endeavour to answer them at the end in our Q&A section. So, alrighty, let's make a start. All right, sorry. Welcome to those people who've just joined us. Again, my name's Ruta and I'm part of the customer success team here at Nookal. And our next level Nookal webinar today is fundamental forms and pivotal processes. So in this session, we'll be looking at the data aggregation processes, also 3 data collection milestones, and also the practical utilisation of the collected data. Also today, we're very lucky to be joined by a special guest, and our special guest today is Tim from Snapforms. So Tim and his team have recently released an integration that can connect to your Nookal account. And by doing this empowers you with a range of flexible tools, which are all designed to help you create many types of fillable forms, ultimately collecting data in a smarter way. All right, so let's dive into forms and processes and see what options we have when it comes to refining them. Alrighty, so let's start with how we can collect data from our clients and patients and the aggregation or collection of data, which we obviously need to do before we can analyze it and make any use of it. So there's many ways you can collect data from your clients. So there's some dependable and assured ways, and there's some other technology-based ones bringing the benefits of automation to minimize manual handling. So the 2 main types are your paper and your digital. And there's also 3 others that we're going to discuss here as well, which are email, verbal, which isn't recorded, and telehealth, which is recorded. And we'll look at those. We'll look at these 3 and how they fit in shortly. There's obviously pros and cons to each of these methods. We suggest your decision to use one over the other should be based on a deeper objective measure rather than the basic pros and cons that you get off a Google search. So firstly, I want you to consider these ideas for now. So firstly, the number of admin staff who are available. So if you're trying to minimize the staff on site, you may want to choose a digital intake process. Or if you're in a rural area with unreliable internet coverage, then maybe paper might be your preference to prevent data loss. Or if your business is built on personal relationships, maybe a verbal feedback survey may get you a deeper insight into your patients and how they feel about their experience. And then secondly, the validation of data before it's committed to record. So data practice processes can pick, digital processes can spell check and they can validate data to make sure all the fields are filled correctly and completely. But on the flip side of that, human processes can make an assessment without needing input from the patient. So one less click on a digital form can make all the difference. So in the end, a combination of both digital versus human processes is most likely to be your best bet. And then thirdly, we've got the storage and backup of data. So we all know that medical and health records need to be stored safely and securely for a significant period of time. But check out some of the broad pros and cons of different types of data collection and you'll see what I mean. So collecting on paper, so some of the pros there, so there's no power or internet needed. You shouldn't see any technical difficulties, and there's an overall low technical cost. And then on the other side in the cons, so we have validation and accuracy. So sometimes it'll be hard to make out details on paper forms, and if a staff member needs to clarify that information, then that's a cost to your business. And then there'll be more processing time and also storage costs. And then collecting digitally or online. So the pros will be the validation and accuracy, processing time, and also storage cost. And then some of the cons being you'll need power and internet, and there could also be technical difficulties. So in this situation, there'd be two types of technical difficulties to consider here. So you've got your hardware failures or technical bugs, and you may need to call your local IT department. And number two, when a patient isn't familiar with the device or software you're using. And then sometimes there's a high technical cost. For example, if you've chosen a tablet or a kiosk style device, then there's a cost for the initial device. There's also the software, security, and also maintenance to consider. So some of you may have realized already that the pros for paper can also be the cons for digital and vice versa. So this is why we need to be assessed on a deeper level, as they truly can be polar opposites with very little difference between them. So with paper and digital being the kingpins, we're missing a few other types of data collection. So let's add them in now. So collecting data verbally. So by verbally, I'm referring to collection over the phone or in clinic or in a consult without a recording device. So it's important to note that the verbal heading doesn't cover collecting informed consent or any other legally binding or legally required agreements. So let's say your reception team is collecting data over the phone or at the front desk. So it's a personal approach, which means you can immediately adjust your patient's experience in a positive way. But it's also a manual process. So there's a possibility of typos and clinical errors. So this fits into our model as an alternative to both paper and digital. And then there's collecting via email. So this is where the pros and cons of all the process start to cross over. So because email is a kind of a middle ground between paper and digital, you get the digital storage and backup component. So that's worth some consideration. But processing the data will most likely be a manual process for your staff as well. And then there's collecting via telehealth or recording. So for those amongst us who has entered the world of telehealth, you'll know that this is another kind of middle ground between the verbal and the digital method. So verbal being you can record it and back it up, and digital, but you may need to complete a manual data entry process following the session. So you need to make an objective choice to which method we should be using in your clinic. So instead of the pros and cons, I propose you should consider these three questions when making a decision on how you collect and aggregate your data. So number one, where do you see your business in 3 years? Number two, how do I ensure the retention and analysis of my data? And then number 3, what communication methods provide the best experience for my typical patient? So where do you see your business in 3 years? By this, I want you to look at your goals and see what you're planning to do with your team and your overall vision. So if you're planning to ensure a hands-on approach, then including a verbal process that makes sure every patient gets a phone call maybe for you. If you're looking to go paperless, then a fully automated digital solution could be the way forward. Then how do you ensure long-term retention and analysis of your data? So for those of you who are already Nookal users, you're automatically backed up and safely and securely. And we've got some powerful reports to help you analyze your data. Plus, if it's digital, you can take it into a spreadsheet like Excel and do your own analysis. But what about those paper collection processes? Are you putting it into a digital system, or are you archiving it in a secure location? Or what about your plan for when you retire? So you can take your Nookal data with you, but you need to ensure you're storing it securely. And there are both some physical size differences and some reliability differences between paper and digital archives. Which finally leads me to what I think is the most important question. What communication method provides the best experience for your typical patient? So I'm sure a vast majority of businesses agree that a happy customer is a returning and referring customer. So can you say you have a regular review of your data collection processes? Did your patients find your intake form easy to complete? Can the average patient complete it in a reasonable time frame? So these questions and more might be easily answered with a quick look at your average and target client demographic. For example, if you took a list of all your patients' profile information into Excel and filtered it into 2 groups based on their date of birth, so under 60 and over 60, and then you discovered maybe 3/4 of your clients are over 60, would you consider polling your patients about their preference of a digital solution compared to a paper or even verbal solution? And if you're a specialist who sees maybe low motor skills or vision impairments, you may find that one brand of device has accessibility software that empowers your patients more than others. So there's no right or wrong answer to these questions. So every business, every person, every patient is different. There's no one size that fits all, which is why a regular review of all of them is important to stay in touch with your goals, your patients, and update your processes to make sure you get the best result for each of these questions. Also, don't forget that with this continued threat of COVID-19, sanitation is paramount, especially depending on your demographic. And a piece of paper isn't necessarily passed around multiple patients like a tablet or a stylus can be. But sending forms to the patient's own device strongly alleviates the handling and sanitization altogether. Okay, so now we've covered the different ways to collect data. Let's take a quick look at when we can collect data. So no matter what kind of clinic you have or what profession or speciality is, there are 3 key milestones that you should be collecting data. So from your physical therapies to your mental health experts, we should all be collecting intake, consent, and feedback. So the first 2 you should already be familiar with already, As for feedback, it can sometimes be treated as the ugly duckling on the group, depending on your role within the clinic. But let's start at the beginning and talk about the intake process first. So hopefully you all know what an intake form is. It's a tool to obtain accurate and up-to-date information from your new client or your patient. We've all seen them in their basic configuration with the name, date of birth, phone number, and so on. So then you also get into information about referrers, medical history, conditions, etc. And then a majority of intake forms also ask about patient goals. So perhaps they might ask, what would you like to achieve in this session? What's your condition preventing you from doing? Why is it important for you to address this issue? So these questions obviously help you align yourself with your patient's goals, but it also makes sure that their expectations at the end of the sessions are met. Also, we see in Nookal about half of the intake forms also include information about previous treatment. So questions like, have you seen another therapist before? Was there anything you weren't happy about? And what aspects were you happy with? So if you're not already asking these questions, they might be worth your consideration because they will give you some insight into your patient's mindset about therapy. It allows you to seek alternative routes to success with this patient now that they're in your care. And then there's a small minority of some interesting fields like instead of asking, how did you find out about us? They're asking for the referrer's name and phone number so they can send them a gift of thanks for the referral. This might be something you choose to leverage and boost your word of mouth for a small cost of a coupon or a voucher for the referrer. For physical therapies, maybe they're asking, are you a member of a gym? Are you a member of a sports team? Do you have a personal trainer? And then asking about the specifics of those. So these things they're asking because they want to firstly get an insight into their patient's demographic and also potentially spot a recurring condition from these groups. And then we've also seen quite a rare usage of asking about daily routines. So asking about sleeping patterns or naps and awake and sleep times, also exercise routines and eating habits, all of which gather a bigger picture of your patient's physical and mental health. So you may consider adding these items as part of your intake or clinical process if you can. And if you do choose to collect this data in a verbally, make sure it's a definitive part of your clinical notes. Don't leave it to a human process to remember to ask. Either way you choose to record it via intake form or verbally, it means you've got it on record. And as the saying goes, you can't manage what you don't measure. All right, so going on to step 2 in your journey. So we're going to talk about consent. And when I talk about consent, you're all thinking informed consent, and you'd be right. But there's also 2 other forms, which I'll talk about later. But in regards to informed consent, so this is a step you should all know about. And if you don't, you do really need to seek some professional advice on what you need to implement. So generally speaking, it's something you see a lot of clinics, including at the end of their intake formal process. Which ensures that it's completed prior to the initial session. And the other two is consent for marketing, which you need to collect if you're going to communicate with your patient for marketing purposes via email, SMS, phone, etc. And these can be tacked on the end of the intake process to make sure it's completed. And you have a record of it on file if it's contested later. And then there's also one which we rarely see, which is the consent to leave messages. And by this, I mean the question, may we leave a message for each communication type? This is obviously to prevent leaving a potentially confidential message with a relative or in a voicemail system accessible to people other than the patient. It's not that you don't already have a process to handle this. Some clinics affix acronyms to phone numbers, so it's also worth looking at whether this is something you want to offer to your patients via a form, or you can resolve it with a strict process. That is, never leave a message and only talk directly to the patient themselves over the phone. So consider your processes for consent and make sure you're meeting all your legal and governing body requirements, but also think about ways to minimize risk to your business by asking patients for other types of consent, not just informed consent. So I'm sure we can all agree that feedback is a key step in your patient's journey with you. And it does take time to collect and collate, but I'm sure we can all appreciate that without feedback, you'll have no insight into your patient's experience. And this is a key part of building your returning and referring customer base. Plus, if you're managing teams of therapists, it's critical that you keep an eye on their work, both for performance and for business success. So there's a couple of different ways you can collect feedback from your patients. So you can ask them in person or via a form with a tell us field, which is great for specifics, but getting it on record with a number value means you can measure it and track it clinic-wide. You also have a range of different options when it comes to feedback. So you've got your thumbs up, thumbs down. You've got your 5 levels of satisfied to dissatisfied. And then you've got a net promoter score, to name a few. So it really comes down to combining those options with a specific question or phrasing to ensure that there's no ambiguity when it comes to what they're giving feedback about. Asking a broad question like, how satisfied were you with your experience, followed by a comment box, sometimes captures too much information, which you need to dig into and collate the whys manually. When recording it objectively, it gives you the power to track trends over time. And by adding additional details known as driver questions like how satisfied were you with the front office staff, or the cleanliness and sanitization of the clinic, even down to the ambience of the waiting room, for example. These help to drive to the heart of the issue. So including these not only helps you collect feedback to monitor, it also helps your team and your patient clearly understand your company's values. And it also shows you have attention to detail. For your team, when you're providing care, this is what is expected. And when you lay everything in front of your patient to say, when you're in our care, this is what you can expect from us. So I'm sure you've encountered the Net Promoter Score, even if you don't think you have, and I hope you have considered using it in your feedback process. So let's take a closer look and see what we can do with it. So if you're not familiar with NPS, it's used to collate or calculate the percentage of clients who are likely to recommend you to a friend or relative. So you can put this into action on a scale from 0 to 10, How likely are you to recommend our services to your friends and family? And those who answer with a 9 or 10 are your promoters. Those who answer with a 7 and 8 are your passives. And the 0 to 6 crowd are your detractors. So the names imply that promoters are your advocates, detractors are your fault finders or critics, and the passives are not quite one or the other. So for example, let's say we've collected some results. So of the 250 patients who responded to our survey about their most recent visit to the clinic, 50% gave us a 9 or 10, 30% gave us a 7 or 8, and the last 20% gave us a 0 to 6. So we know that the net promoter score is the percentage of promoters minus the percentage of detractors, which gives us a total of 30 on a scale of -100 to +100, where any value over 0 being a positive result. So what's a good net promoter score? So this actually varies depending on your industry. Retently.com's 2020 NPS benchmarks put the healthcare industry at 27. So by those standards, our clinic is average. But healthcare is a very broad term, and that also includes regional influence with different healthcare systems. So a 0 to 30 is a good range, but with room to improve. 30 to 70 means you have more positive experiences. Over 70 and you'll be seeing a lot of word of mouth referrals. So by that reasoning, our clinic can come in line between good and great. But before you can figure out what your target score is, you need to start collecting responses. Then make a subjective assessment of where you think you should be scoring, and then do a monthly and quarterly comparison. So you can know what to expect of yourself, your business, and your team. Or you might want to consider consulting your local peers to see what their net promoter score is and how you compare in your region for a comparative service. You might get a nice surprise. So the net promoter score is just one of many tools to collect customer satisfaction, but it's certainly one of the easiest ways to measure overall satisfaction. So you might consider focusing on the net promoter score feedback in particular, on a particular class or service rather than the entire business. So how likely are you to recommend this group session to your friends? Plus, this increases the chance of receiving a word of mouth referral, especially if you consider pairing it with a rewards program. So let's go back and take a look at our intake data and see what we can do with it to get some insight into our clinic. So I'm going to take an example CSV export of a Nookal client list. So in the spreadsheet, this spreadsheet includes the profile information collected during the intake process. So if we take it into a spreadsheet software, we can optionally exclude inactive and deceased patients by removing them so they aren't impacting our measurements. We can calculate the average demographics, so just convert the date of birth column to years for an approximate age. And then with that age and gender, we can set the age, we can see the range of age groups and genders we service. So ultimately, consider if we need to look at a more age or gender specific services. Because as you can see at the bottom right, 44% of our clientele is over 60 years old. We can also extract a spread of postcodes for our clients' addresses, and this will give us some insight into how to reach within our local and extended community, and how far our word of mouth and advertising extends. And if you have multiple location practices who manage some or all of your clients per location, you can apply a filter, filtering your demographics and postcode breakdowns. Or if you use specific codes or acronyms or words within your client profiles, you can use them as part of your analysis too, maybe to measure bad debtors or even the number of patients with specific needs. And one of our more powerful data points we can extract from our client list is the expected growth of new patients. So if we look at our registration date in our client profile, we can get a group, we can group this into date ranges and see our history. Then we can apply a trend line to make a prediction of prediction of the number of new clients we can expect if we continue as is. So make sure you have a look at all your data you're collecting and storing with your processes, and make sure you've extracted all the insight you can from them. Alrighty, so now I'd like to introduce and welcome our guest, Tim Wilson from Snapform, who's graciously joined us today. Snapforms is a platform to create and share online forms, and their recent integration with Nookal your Nookal account means you can collect patient information with ease. Tim is one of the masterminds behind Snapforms, so it's our pleasure to have him here with us today to talk about their platform and the integration. Also, if you do have any questions, please feel free to place them in the chat window and we'll do our best to answer them in the end. Alrighty, thank you, Tim. Take it away.
And thank you everyone for joining on a Friday afternoon. I do see some familiar faces in the participant list. Some people are already using Snapforms. So thank you for those jumping on. Hopefully you can help describe the benefit of using Snapforms in your practice alongside what I'm going to go through today. So I'm going to do a bit of a walkthrough of how we see Snapforms fitting in a lot of practices, especially over the last year with COVID. I think going digital, or at least giving options for practices and our patients to do these forms in a digital format, I think is what, COVID unfortunately really pushed that along at a much quicker rate than what we'd seen maybe in previous years. I'm just going to share and we'll go through a bit of an overview. So just a little bit about Snapforms. So Snapforms was founded in 2012. We service many customers across many different industries. We service about hundreds of thousands of responses every year, not specific to healthcare, but healthcare, as you see here, just a general list of some of the clients we serve. Healthcare is a big part of that. Healthcare naturally having the requirement of Australian privacy, Australian security, hosted onshore, and that's where we really come out against our competitors. And now with this integration with Nookal, we're really helping, in our view, streamline practices on how they have patient intakes, how they collect information on their patients, and really giving different options on how you collect that patient information. And speaking from personal experience, going into practices, whether it's a doctor's or a physio or a chiro, all these different practices that I've been to personally, I think the thing that rings true to me, and then I'm probably a younger generation, so it will depend on your demographic, as Ruta said, but for me, that digital approach, and I can walk up to a counter, I can scan a QR code, and I can do my patient intake that way rather than handwrite it out, or it can be emailed to me before time. A lot of these innovations, to me, helps increase that experience in that practice. So that net promoter score that Ruta went through, if my experience at that initial point of contact with a practice is positive, or it's different, or it was better than the last one I went to, then, I'm much more likely to then go to my friend and say, I just went to this chiropractor, and, instead of filling out this form for 10 minutes, I filled it out beforehand. I just walked in straight into my appointment. So I think looking at things a different way, or at least giving our patients and clients options, I think is where we'll see the benefit in using these new digital tools. So to jump in where Snapforms fits in with Nookal, what I thought might be useful is one, to show a little bit about our platform, how our platform works. For those of you that haven't seen Snapforms before, we are a form builder. So if you think of the patient intake forms that you have your patients fill in, or any other form, PDF, that your clients or patients fill in, that is where Snapforms can step in and take the place of that offline process. Whether that's making it easier for your patients to fill in, or whether it's making it easier for your admin or reception to take that data filled in by your patients and put it into your systems, whether it's manually or automatically with an integration like we have with Nookal. Hopefully it saves you cost as well. But our form builder, we design it with, our primary purpose when designing any features is for it to be easy to use, but have the power and flexibility to be used in any way as well. So I've got a sample form here, a patient registration form. This probably applies to most on the call, I'd hope, or you can at least relate it to how it might work to some of your forms. The layout might be a little bit different. We have a number of these as templates. This particular one is a template. I've just added some colors and logos. This is something, if you're not using Snapforms already and you want to get started, there's a starting point, but you do have the ability to create your own forms completely from scratch. And essentially that's done really with a drag and drop. We've got nearly 30 different types of fields you can make use of. You drag it onto the form, and you can design it that way. And it's easy to use in our view, hopefully in yours as well, where you just click, drag, and the form will naturally align to how you want it to be used or how it should look. Now, as far as connecting this to Nookal, it's also quite easy. You can do that you start that from within your Nookal login. So over here, I'm in our Nookal environment, probably not as filled out as most of yours, but here, if you go to the setup section and then in connections, integrations, and in a list of integrations, you should see a Snapforms integration, which you can turn on with the slider. And then within here, you'll see your API key. Now this API key is important, as that is the connection between Nookal and Snapforms, and you'll be able to use that consistently across all the forms in your Snapforms account. So just the one API key to any forms that you create, and I'll show where we put that in. So if I copy that, you go back to your form within Snapforms, within form settings, and then integrations, and then in Nookal, you'll turn that on. You'll put your API key in here as we just copied out of Nookal. And then we have a few options that the integration can be used in a few different ways. And I'll demo a couple of these as well so you can see them in a practical use. The primary one being creating a new Nookal client from a form response if one doesn't already exist. So again, this is a new patient registration form or an intake form. So it's going to be important that I create this automatically, so that Nookal will automatically create this patient from the details filled in on the form. Again, saving that admin step of filling them in manually or by your reception team. We also have the ability that if the patient already exists in Nookal, we can take the details from the form and update that patient. So maybe they've changed address, or they have changed their contact phone number. There's ways for them to give that to you automatically and automatically sync that to your patient file. Again, so you make it easier to keep in touch and keep that information up to date. We also have the ability to take a snapshot of the form that is filled in and attach that to the patient file in Nookal. So you can keep that history. Maybe it's a form understanding what symptoms they have before they come to their appointment. Use the chiropractor or physio example of, where is the pain? And does it hurt when you bend your knee or when you bend over? Getting all that information before the appointment or during, and then having that automatically attached to the patient file as well in Nookal. Now, the main, we have the ability to match fields in Snapforms to different fields in Nookal. So we can take any of the fields that I put on the Snapforms form, first name, for example, and we can match it to any of the fields that exist in Nookal as well. Now, there's a common question of, can we have more fields to map to in Nookal? That's something we're working with Nookal on. So we're looking to add to these available fields in Nookal. So that will come. But for now, there's a number of fields you can sync this information to directly, and I'll show you how that comes across in a moment as well. If we now take all this and we take the, put the shoes of our patients or clients on and look to fill in one of these forms, as I said, these forms can be filled in the practice in your reception or waiting area. A good example might be to have a QR code on the reception desk, and then when they walk in, they can use their own phone, they can scan that QR code and it brings up this form and they fill it right out. There's no, you keep that contact low with COVID. You keep that hopefully experience for those that want to do it, a positive one, using their own devices. A lot of people are more familiar now with their iPads or iPhones and phones in general than they may be using a pen and paper, but still being able to support those patients that do want to use the pen and paper and keeping that process in place as well. So if I fill this out here, I'm going to fill in just a few details. I'm not going to fill in the whole form, just in essence of time. Going to put a dummy name in here and give Tom a date of birth of maybe February 2000, February 1st, 2000. I'm going to use an email here. And we support a number of different field types, a common one being signatures. You want to make sure that maybe they're confirming that they're okay to be contacted, or confirming that this information is correct, confirming they understand whatever policies or procedures you may need to collect before seeing this new patient. We have the ability to draw a signature. Again, this might be with a mouse, or it might be with a finger or a stylus on an iPad, or we have the ability to type out a signature as well. Remembering Tom's last name, Tom Smith. We can make that look a little bit different. If we submit that now, we should automatically see that sync across to Nookal. So we should see within a matter of seconds, Tom, who won't exist in my system because he is a new patient who's just arrived today for his appointment, we should see him exist in Nookal right away. Refresh. I don't see Tom, unfortunately. I'm going to grab a different one we've created. So we've got Tim. Now we've got Tim's information that was filled in on the form. And then if we also look at our documents, we'll also see a copy of the form we just filled in as a PDF with the signature. So this is the form we just filled in. I've taken a different patient just because Tom hadn't synced across just yet. And we've got Tim here, essentially the same as well. Now, to the same extent, we can have a look at this form again. And we can take Tim, who is already a patient now, make sure I get the right Tim, get his date of birth, because the system will automatically do a match. So Tim's date of birth is the 1st of January 2010. Nice signature. And just tick some extra boxes so we can see that change, and we hit submit. Again, relatively quickly. We have a look at Tim and the documents. We see an additional patient file that's just come in. So that's synced within minutes, or within seconds really. And we see that new file we put in, again, with that lovely signature I put in. So we see that sync instantaneously of information. Now, if we enabled the ability for Tim's information to be updated, for example, if we filled in a different home phone or work phone, we could have Tim's profile automatically updated with that information as a part of that sync, or you may choose to keep that as a manual process, depending on how you take that information in. So hopefully that gives a bit of an idea of how that Snapforms may be used with Nookal. I do welcome questions in the chat. I can't see the chat while I'm sharing, so I'll stop sharing in a moment and take a look at those questions. We also welcome anyone who isn't already using Snapforms to jump onto our website, get in contact with us. We've got a friendly team that you can have a live chat with if you have any questions. We can help you through, we can help you set up your first form. And if you're not confident in our form builder, or you don't have confidence in being able to recreate maybe some of your more complex forms, our team's more than happy to help out in getting you started in your trial. The trial is completely free. There's no restriction. There's no credit card take on that trial creation. So you can really try us out with no risk. If after 30 days you feel you want to continue, then you can look at one of our subscription levels depending on our needs, on your needs, and hopefully you see a benefit for those patients or clients of yours that do want to use a digital process. All right, I will hand back to you, Ruta, if you want to coordinate any of the questions, and I'm happy to answer that have come, any that have come through as well.
Thank you so much, Tim, for that presentation. I'm sure we're all more educated about Snapforms now. I know we do get a bunch of questions on our support channels around Snapforms, especially around additional fields. So it's great to hear that you're going to be adding some additional fields, which is awesome. So yeah, let's look at some questions. So firstly, we've got a few questions here. So I can see I've got a question here from Darren in regards to adding an acronym to phone numbers in relation to consent. So by this we mean you might want to add a prefix in front of the patient's phone number, for example, DNV, which will mean do not leave a voicemail. So as part of your reception team's process, you could identify those acronyms prior to contacting your patients via those methods. I hope that clarifies your question, Darren. Thank you so much for that. Also, we've got a question here from Vivian. Why won't Nookal let you run reports filtering out deceased patients? So broadly speaking, we don't filter out patients in all reports, as they may have outstanding debts that your accountant needs to address. It can also affect the performance of reporting. Sorry, it can also affect the performance reporting to filter out patients as well. So I hope that answers your question, Vivian. If we have any Snapform questions for you, Tim.
Yeah, I'll go through a few of these questions. Thank you for those that have posted some questions. I'll do my best to get through a few of these in the time we have. Got one here from Grant. Is a typed signature legal? And that is something we actually do come across, or a question that's asked of us quite often. What we find is and many of you have probably used DocuSign as well. A typed signature is legal to the extent that they are fully aware of what they're accepting, and you're not automatically ticking acceptance. So there must be a clear and obvious acceptance that they are ticking or signing on the form, and they must be very clear on what they're accepting or signing. So if you're building an online form, you wouldn't hide the terms at the top of the form and get them to accept at the bottom. And most of the requirements for a legal signature that apply to an offline signature or like a pen signature apply to an online form as well. It's basically just proving or showing that they are accepting, they are aware of what they're accepting, and they have actually made the acceptance on their own without assistance. Another question here on, can we change the name of the saved name of the document? That's a really good question. We actually have this feature coming shortly, the ability to customize the name or the output of these PDFs, which would essentially change or update what they get synced into Nookal as. So that one is coming soon. We will get a more updated date, and if I get who that question is from, maybe Ruta or Austin, if you can help out who that is, we can keep in contact with you and let you know when that feature is close. We've got a question here from Philip. So great product, thank you, Philip. I just wanted to check if any plans to extend the functionality to pre-populate the form with data already in Nookal. So yes, we do have this as a plan in our next release of Nookal. So our first release was at least to get these syncs, new creations and update syncs across. We have a internal program where we're working on new updates, and that includes, which a few people are asking as well, the ability to sync additional data. Like I think Medicare number is a really common one. We need to work with Nookal on those changes as well, and it's a development on both sides. So we're working with the Nookal team to enable more fields via the API that we can populate through to. So again, that's coming in a new release as well. We're hoping to come out, in the short term, in the next quarter. Another question here from Joe: can we automate the emailing of that form through Nookal like we can now with the automatic intake form in Nookal? So yes, whenever you create one of these forms, you will get a few different ways that you can share or use these forms. The most common one when using a tool like Nookal is a direct link. So any emails or SMSs that you send to your patients or clients, you can include the link to one of these Snapforms. So it'll automatically go out with any communications you have with those clients. So that would be the best way to share that automatically. So as a question from Gillian here on whether you can send multiple forms. So exactly the same as sending out these forms automatically, you would potentially just send multiple links in your email communications or SMS communications. Or you can embed these forms on your clinic website for people to fill in the forms straight on your website as well. And you can do that with multiple, there's no problem there. You can also, a common use for Snapforms is to streamline. You might have 5 different forms that your patients need to fill in, maybe at different times or maybe all at one time. And we can control and combine all those forms into one digital form using conditional logic to show or hide fields based on what they pick. I look back to my physio example earlier, where I maybe pick where I'm feeling pain. If I'm feeling pain in my knee, another pet question might pop up and ask, is it the anterior part of the knee or a different part of the knee? So you can really have a lot more flexibility and control on how you take that data as well, which is a little bit more difficult when it's a paper form. Is there a function to set up a way that new patients will automatically be sent new patient forms or after appointments feedback forms? So, typically we would advise using a tool like Nookal or other tools that manage the communication to the customer. We can absolutely send information to the customer or client patient after they filled in one of the forms, but that sending out the forms or pointing them to a place where the forms are stored on the website is the best way to get them to fill in a snap form. A question from Square One Physio: are all fields able to be made mandatory? Absolutely, yes. You can pick and choose which fields on the form are mandatory, whether it's one, all, or a selection of fields. And I think I'll hand back to you, Ruta. There might have been a couple of questions that have come to you post. And if I have missed any questions, Austin or Ruta, if you could maybe copy the questions, and we're happy to follow up with people after this as well, and make sure we get your questions answered.
Yeah, no problem. We'll definitely do that. Yeah, I've got a question here from Grant. Nookal doesn't export extras. How can we analyze the data we gather? So extras data is exported in the client CSV, but if you will need, so you'll need your IT developer to assist in that analysis process. You can also extract that data via our API. Again, you'll also need your IT developer to assist you as well. We do have plans for reporting around extras as soon as we can. I think that might be all we have time for today. That is all we have time for today. Thank you again for joining us for our next level webinar session. I hope you did find it informative and helpful in your forms process. Also, thank you, Tim, for joining us today and giving us an overview of your awesome product, Snapforms. If you do have any questions, please don't hesitate to contact us as well. Also, before we leave, we are going to we've got, we'd like to practice what we preach, and we are going to hopefully, we do have a feedback form that we'd like you to complete. So we're going to put that link into the chat window to save you typing it in. So even if you're watching this recording later, we do appreciate you completing that feedback form if you can, and letting us know if this is the type of content you're interested in seeing from us. Every bit of feedback helps us tailor these sessions to suit your interests. Finally, again, if you do have any more questions for Tim or for Snapforms team, please get in touch with them via snapforms.com.au. Also, if you have any questions for Nookal, you can contact us or find us at nookal.com. Thanks again for watching, and thanks again for Tim for joining us. Have a great weekend, and peace, love, and happiness. Thank you so much. Take care, everybody.